Good Wednesday afternoon, ladies and gentlemen. My name is Adam Cooke. Once again, Telile Community Television is providing local analysis and recaps of the COVID-19 media briefings for Nova Scotia. We're going to have today's recap from Wednesday, January the 12th. You'll hear in just a few moments from Dr. Robert Strang, Nova Scotia's Chief Medical Officer of Health, and the Premier of Nova Scotia, Tim Houston. We may find out a little bit about what's going to happen in terms of testing and whether rapid testing sites are going to keep coming in different areas of Nova Scotia. We haven't heard anything from Richmond County yet. We did find out this week that there were going to be 3 rapid testing sites set up in Inverness County. One of them just wrapping up right now, Inverness Legion at Central Avenue in Inverness. That just wrapped up at 3 p.m. after being open since 11. There's going to be another one coming tomorrow, Thursday, at the Port Hood Fire Hall on Main Street in Port Hood. That is running from 11 a.m. to 3 p.m. And for our viewers who might be handy to the Cheticamp area on Friday, that's January the 14th, at the Cheticamp Seniors Hall behind St. Peter's Catholic Church, there's going to be another rapid testing pop-up clinic taking place from 11 to 3 on Friday. So we hope to get some more information on how testing is going to proceed. We're hearing now that testing is causing such a difficulty across Nova Scotia, especially in terms of getting accurate numbers, that the province is starting to shift away from announcing daily case counts and overall active case counts. We had heard from Dr. Robert Strang, the Chief Medical Officer, just last week in one of the previous briefings that this could be the case, that you were going to hear more about hospitalizations, outbreaks, and deaths due to COVID-19 as opposed to case numbers. That so far is the case. The last case numbers we have for you came yesterday, Tuesday, January the 11th. 616 new cases announced yesterday, estimated to be just over 6,700 active cases for Nova Scotia right now. We have 60 hospitalizations that were announced today due to COVID-19. Of those COVID-related hospitalizations, 4 people are in the intensive care units, so we're going to keep our eye on that situation as it goes forward. No new outbreaks announced for the time being. We'll let you know if that is the case. We have seen outbreaks in the past few weeks at Inverness Consolidated Memorial Hospital and at St. Martha's Regional Hospital in Antigonish. Those seem to be contained right now. Nothing new in terms of those. We're hoping for the best. There was less than 5 people involved in each of these outbreaks, so we're hoping for the best in that regard. We're expected to hear more about what happens for public schools in this particular media briefing. Students are taking online learning this week. That started on Monday, January the 10th. They are expected to go back in on Monday, January the 17th. That's a week later than was originally planned. But we haven't heard anything yet as to whether that strategy is going to change and whether the students aren't going back into school for in-school learning on Monday. So stay tuned, ladies and gentlemen. We are going to come back after the media briefing is over with a recap of what's happening and how it affects you here in our Telile Community Television viewing audience. But we're going to hear in just a moment from Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang, following some opening remarks from the Premier of Nova Scotia, Tim Houston.
Good afternoon, everyone. Today we're going to talk about hospitalizations, testing, schools, and the booster situation as well. So let's start with the hospitalizations. There are 60 Nova Scotians in hospital with admissions related to COVID. 2 of those 60 were hospitalized before the Omicron outbreak. Of those who are in the hospital due to COVID, 5 are in the ICU. The average age is 66. Of those in hospital, 25% of the people in hospital have no vaccination. There is 1 young child under the age of 5 in hospital. The average length of stay of a COVID patient in Nova Scotia hospitals right now is 5.8 days. So we never want anyone to enter the hospital as a result of COVID. Every hospitalization is scary and it is a concern for sure. But that said, it's still true that we have not seen the severity with this variant as we have with previous variants. In fact, I'm sure most people watching today know people who have COVID or have had COVID, and in the vast majority of cases, those people are now better or are getting better. Few of us would know someone who has gotten severely ill, and certainly a few of us would know somebody who's had to be hospitalized. But it's happening. 60 families today, 60 patients just today, and I certainly don't want to minimize those who do get severely ill by this variant. It's inevitable with any virus, particularly those with underlying conditions or are otherwise vulnerable, and certainly those that are unvaccinated. So, but that's the update on where we're at today. In terms of testing, I just ask Nova Scotians, please bear with us on the changes to the testing. Change is hard, but it's time to change our testing strategy. As we discuss the evolving nature of this pandemic into what we hope soon becomes endemic, we have to change our approach to testing. To date, Nova Scotia has been the envy of the country in terms of the public's commitment to testing. To be totally honest, I've been a regular for months at either stopping at a clinic for a PCR or a rapid test at home. It's always been something that I've been doing just during the pandemic, and it's always provided a great deal of comfort. So I get it. I get that the change is difficult, but we have to start moving away from the way we've been testing, and we have to make that move for a couple of reasons. The first being we no longer need to use extensive testing to confirm the existence of the virus in our communities. We know it's here. So right now, the best thing we can do is if you're sick, stay home. But even if we wanted to continue testing at the same earlier pace, it's just not possible due to supply issues. If you've turned on the news over the last few weeks, you've no doubt heard discussions about supply chain concerns across a variety of products, and the testing is no different. So to date, we've always been supplied with rapid tests by the federal government. As this variant started to take hold back in early December, when other jurisdictions were also starting to look at our way of testing, we saw that the writing was on the wall, that demand would be there for testing. We ordered approximately 2 million more tests. That would be in addition to the federal allocation. So we continue to wait for those tests, but we're hopeful to have updates soon on their arrival. At the same time, the federal government has been actively working to procure more tests. Last week, they announced the purchase of 140 million tests. So Nova Scotia will get its share of those, but the arrival of those tests is up in the air. And every province is in the same boat. I can tell you that in discussions with the premiers and the prime minister, that was the number one thing. When will the tests be there? And there's a lot of questions around the supply chain issues. So that said, we do expect to start seeing small portions arriving from the federal government next week. And then hopefully every week thereafter. But right now we have no guarantees on arrival dates. So as a result, we've had to be more conscientious about how we use our rapid tests. And I want to be very clear about where we are in this province with rapid tests. Right now, we are distributing about 830,000 rapid tests per week across the province. And these tests are going to testing centers. They're being used for outbreak response. They're being used in Nova Scotia Health workplaces, other high-risk areas, and a community stream. So we wish there were more tests, but 830,000 tests a week is almost a test for every single person in this province. And that is not an insignificant number, particularly when you consider that there is no need for every person, or even for most people, to be testing once a week at this stage. It's not the time for everyone to test every day or every week. There was a time for that, but that time has passed. So we will continue our focus on community testing to ensure that everyone who needs one has access to a test. If you need a test, you'll get a test. But that's where we are with testing today. So in terms of schools, I want to discuss, we've talked about testing in the schools. School goes back on Monday. And I made some commitments as to how we as a province would use the week in preparation for that return to school. And I can tell you that updated ventilation system in those 71 schools that we identified has arrived. Those systems are on the ground. They arrived on Monday, and they've been distributed to classrooms across the province. So that's good progress there. We've been able to make 3-ply masks available for every teacher and every student. That's a good thing. And despite the challenges that I just laid out, there will be access to rapid tests. We've talked to our expert panel on testing. There's a panel that provides guidance on testing. It's 10 leading experts that we turn to and discuss testing, and you would be familiar with the names of those experts. They're highly qualified people. So we discussed with them the current supply issues and the potential shortage, and their recommendation is to focus on making tests available in communities so that when the tests are most needed, they are accessible. So we will continue to do that, but we will also make sure the tests are available in schools. We'll be distributing approximately 25,000 tests across the province to the nearly 400 schools based on enrollment, but we'll come up with that and get those tests out there. And those tests will be available based on a need for testing. So primarily for students and staff who come to school symptomatic or develop symptoms while at school. So I just want to say I understand the anxiety and the degree of hesitation that people are experiencing, teachers and parents in particular regarding back to school. But I've said it before, and I'll say it again. Our schools are safe, and the best place for our children is in school. This is the advice of public health. This is also the advice of leading pediatric doctors in this province at the IWK and elsewhere too. The best place, the safest place, the warmest place for many of our children is in school. So to parents, if your child is sick, as you would have in the past when they were ill, please keep them home. But school will be returning back in person on Monday, and I thank teachers and staff for the incredible effort that was made this week with the online learning, and I know the effort that was made in preparation for students to arrive on Monday. Thank you for that. Next, let's talk about the boosters. As of today, 49.6% of the public that is 30 and older and meets the NACI recommendations already have or have booked their third dose. Yesterday alone, 17,104 boosters went into arms. That's a single day record in this province. At the height of the program last spring and summer, we were doing about 12,000 shots a day, so that's an incredible effort. This is a testament to all those Nova Scotians who have stepped up to help us immunize. I thank you. I know there's still some who have put their name forward and still anxious to get to work helping, and we're working through. We were pretty blown away by the response that we had, and we thank you for that. And we still need your help, and we will be in touch. But today we have clinics up and running in Halifax at the Forum, in Dartmouth, Wolfville, Truro, New Glasgow, Amherst, Antigonish, Sydney, and Berwick. We're opening a clinic tomorrow in Yarmouth, with more opening in Digby and Truro on January 24th. Drop-in clinics are happening all over the province. This week we're offering outreach clinics at Centre 200, the Captain William Spry Centre, Kingston Fire Hall, Shelburne Fire Hall, Metro Housing, St. FX, Wallace Community Centre, the Alley Centre, and others. I think you get the point. There's a lot of work being done to make sure that you can get your booster. So thank you to everyone who has done their part and got vaccinated or who is helping administer the vaccines. Our province is safer because of each and every one of you and your efforts. So thank you for that. Just in closing, I'll just make a comment about the healthcare system. You can see there's a lot happening, and I want to tip my hat to those on the front lines, keeping things flowing, keeping things working, keeping things happening. COVID is impacting every aspect of our life, and the healthcare system's not immune. We're seeing impacts on wait times, on patient flow and surgical care. Some scheduled surgeries and procedures were postponed last week, and more will be impacted over the next couple of weeks as we work through this. But we are working through this. Our healthcare workers and healthcare professionals on the front lines continue to step up under incredibly trying times. We're working to move people and support you where we can. But I want you to know we see you, we hear you, and we really can't thank you enough for what you're doing. So hang in there, please. Dr. Strang.
Today, I want to offer my deepest sympathies to the 5 families who lost loved ones due to COVID this past week. And unfortunately, there are too many other Nova Scotia families know what you are going through. I sincerely hope that these deaths are an unfortunate reminder to everyone that this virus still can have deadly consequences for some people. I know that many are questioning the restrictions we have in place or even the seriousness of COVID. Maybe you've had COVID or know people who've had it, and you think, what's the big deal? That in your experience, people felt sick for a few days but then recovered, and it seems to be just like the flu or a cold. For most of us, I'm very thankful this is true, and to me, a lot of this is attributed to the vaccines doing their job. With over 90% of Nova Scotians having at least one dose of vaccine and a highly transmissible virus, we are seeing many vaccinated people get COVID, and that's not a surprise. But being vaccinated is protecting most people from severe illness and death, which is really what we're looking to prevent. But unfortunately, this is not true for everyone. And I'm sure if you ask the people in hospital or the grieving families if they thought this could happen, they may well say no. But it is happening. 5 people died this week and 60 people are in hospital today because of COVID infection. And those numbers continue to creep up, the numbers of hospitalizations. And they're people. They are our aunts, uncles, neighbors, coworkers, and friends. They're not just a number. There are factors, age and underlying health conditions being the main ones that put people at increased risk for hospitalization. And we all have these people in our family, in our work or social circles, perhaps even without knowing it. And those people are relying on us. They need us to help keep them safe. And those most vulnerable are also relying on the rest of us to follow the public health measures that limit the spread of the COVID virus. We've all been working for several weeks to slow down the spread of this variant, and we do have several weeks ahead of us. While we've made some changes to the length of time people need to isolate, based on how this virus is acting, there are still thousands of people who are not able to work because they are isolating due to COVID. Hundreds of healthcare workers are not able to work in a system that was under immense pressure even before the Omicron wave. Nova Scotia Health has between 500 to 700 employees off work on any given day due to COVID. These shortages are happening across the entire health system, from long-term care and home care to emergency health services. With every wave of the virus, we've asked our healthcare providers to do more. They are tired, frustrated, and more than a little bit anxious. Many were called back to work during the holidays. Most people are working on teams that are short-staffed, and many are being redeployed to other areas of need that they may not have as much comfort in working in, but they need to be there. Nova Scotia Health has once again asked people to cancel their vacations, but it's still not enough to relieve the stress on the system. Patient volumes are at a high. Staff are seeing higher visits to emergency and experiencing delays in admitting patients. And outbreak cases among patients already admitted for non-COVID reasons have also gone up. And managing these outbreaks requires more staff, time, and effort to prevent further spread. The healthcare system impacts of this wave are requiring that entire system to take significant steps to alleviate pressure and create more capacity. So it's paramount that all Nova Scotians do what we can to protect critical health services and urgent cancer care for patients who need it the most. This means reducing other services for the time being. And I know those decisions aren't made lightly at all by Nova Scotia Health, and they do come with their own significant impacts. But please know that the situation is being monitored closely, and every effort's been made to preserve services as much as possible. Let me move on to testing. There continues to be confusion, even anger about testing. We've made a lot of changes, and for the last year, we've recommended testing as a way to find as many cases as possible and stop the spread of the virus. Then along came Omicron, and now we're pulling back and changing our approach to testing. We have to do this, but it's no wonder that there is confusion. Given the amount of virus that is circulating in our province, we can no longer identify or need to identify every single case of COVID. And we need to focus our testing resources along with other resources on helping to prevent severe outcomes. But at the same time, it seems everyone wants a test and feels they're entitled to having rapid tests at home to use as they see fit. Unfortunately, supply continues to be a challenge, not just for us, but across Canada. And we need to use rapid tests more efficiently and equitably. We currently go through more than 800,000 rapid tests per week across all testing streams. And this will increase even more when tests are distributed to schools and we are able to make more tests available to the community. But right now we have just over 1 million tests in the province. So our supply is very precarious. We're expecting another 3.6 million tests from the federal government this month, but we don't have them yet, and shipping timelines continue to change. So that's why we're prioritizing testing to focus in the following areas. Testing centers for people who have symptoms or have been identified as close contacts, for outbreak testing, for example, in long-term care facilities. At workplaces where employees support vulnerable populations that are at greater risk of severe outcome, including long-term care, correctional facilities, and shelters, school children and staff, and at community distribution centers in areas that have surge in cases or have longer distances to travel to testing centers. And it's also why we put pause to some of our testing streams, such as rapid testing in a large number of workplaces that don't support directly vulnerable Nova Scotians. Rapid tests were once readily available for most Nova Scotians, but now you need an appointment to get a rapid test, and not everyone will be eligible to get one. This is the reality of dealing with limited supply. And while you may not be happy about this, we all need you to understand and accept that others may have to be a higher priority than ourselves. Please do not get angry at frontline staff or try to find a workaround. Put others ahead of yourself and be kind to those who have been caring for you for over the past 2 years. They deserve nothing less than this. Once we have more rapid tests in the province, we'll work to make them available in more community locations to pick up without an appointment. But right now, to avoid frustration, the easiest way to book the right test, whether it's a PCR test or a rapid test, is by going online and doing the self-assessment. The kind of test you need depends on your age, whether you have symptoms or not, and some other factors. Doing the self-assessment is a requirement before you go to actually get a PCR test or pick up rapid test kits. The address is covid-self-assessment.novascotia.ca. And if you cannot do this online self-assessment, and only then, you can call 811. Please do not try to find a way to avoid doing the self-assessment. You could arrive at a testing center for an appointment only to be turned away if you haven't done the self-assessment. And do not just show up at a testing center or you certainly will be turned away. You need to do the self-assessment and get an appointment and then go get your tests. We ask for your patience and cooperation while we rebuild our testing supply and work to make rapid tests available in more community locations. So in closing, I want to say to people, if you don't think Omicron is a big deal, you're absolutely wrong. It's a risk to people who are vulnerable, people we all have in our lives, people we know and love. And it's a risk to our healthcare system, the system we all rely on to care for us and our loved ones when they need it most. There's no doubt we are in a very serious situation, the most serious we've been in during this entire pandemic, given all the pressures on our healthcare system. This is different than other waves. We've never before had hundreds of healthcare workers not able to work, or so many cases that public health is no longer able to identify and closely manage each case and all their contacts. So if you're not carefully following the restrictions, if you're not wearing your mask consistently and properly, if you're not keeping your social circle small and consistent and limiting your social activity, if you're not staying home when you're sick and following the rules for testing and isolation, if you're not contacting close contacts when you become positive, if you're not vaccinated, any of these, if you're not doing them, you are contributing to Omicron spreading at a faster rate. You are contributing to the immense pressure on our healthcare system, and you're potentially putting someone you know and love at risk. None of us know who we may interact with who could end up being severely ill from this virus. And any of us could be the next to need the healthcare system for urgent or emergency non-COVID care. If I sound concerned, it's because I am deeply. And I'm asking every Nova Scotian to please step up. Take this seriously. Do your part. Many of you have been, but too many are not. Omicron really does require everyone, every single one of us, to do what they can to start this wave trending in the right directions. The actions of every Nova Scotian matter right now. So please make your actions count for our collective well-being. Thank you.
We'll now take questions from media participating by phone. We have a long list of reporters on the line, so we'll do our best to get through the 17 or so folks that are joining us today in the time we have available. We'll take one question, one follow-up, starting with CTV's Natasha Pace. Natasha?
Thank you very much. Premier, you mentioned that ventilation systems are on the ground in Nova Scotia, but will they be installed in the 71 schools that need them by Monday when in-person learning resumes?
Yeah, hey Natasha, thank you for the question. Yeah, my understanding is that they're actually physically in those schools now and will be in the classrooms by Monday.
Natasha, do you have a follow-up?
I do, thank you. Dr. Strang, with 60 people now in hospital, including a child, and hundreds of healthcare workers currently off work, is the healthcare system at or close to a breaking point at this time? You seem very concerned today.
So I think if you ask anybody working in our hospitals that it is a very concerning time. I wouldn't use the word breaking point. You are going to hear more from NSH later today about more specific steps that they're taking to reduce services in many areas, to be able to manage the requirements of the number of patients in hospital, either as a result of COVID or they come in for a hospital for another reason, or they're tested. They still need additional care, or people who have even been exposed in the hospital. There's no doubt that our hospital, our acute care system, is under extreme pressure right now.
Moving on, we'll go to CBC's Jean Laroche. Go ahead, Jean.
Good afternoon, gentlemen. I just wondered, Dr. Strang and Premier, you've talked about the number of people in hospital with COVID at 60 today, but I wondered why there isn't a breakdown more accurate, because we're hearing that the situation is far worse than is being let on, that there should be a breakdown of people who are hospitalized with COVID, people who test positive at admittance, and people who test positive while they're in hospital. In other words, they get hospital-acquired COVID. So could you tell us why you're not detailing it to that extent, and whether or not you're giving a true picture of what's going on inside the hospitals?
Yeah, I think I'll go first, and then maybe Dr. Strang can add. But I think what we're trying to do is we're trying to focus on COVID, on the variant itself, and the impact it's having on our communities and on our systems, including the healthcare system. So, from that perspective, it's people are wondering about the severity of the illness. If I get sick, if I get the virus, am I going to end up in the hospital? What are the impacts going to be on me? So our focus has always been on the severity of the virus in terms of how often does it get to the point where somebody has to be hospitalized. I think that's the most important. It's the thing I get asked most. It's the thing that seems to be most on the minds of Nova Scotian. There are other people in the hospital for lots of other reasons, and sometimes people show up at the hospital for some other reason. I don't know, just use an example. It could be a hip injury, and find out that they're asymptomatic for COVID. Or we've had some outbreaks. We've been spoke very frankly about the outbreaks we've had in some of the long-term care facilities and in the hospitals themselves. So what we've focused on in this province, and I still think makes most sense, is focused on the impact of the virus on the people when they contract it. Will you get so severe that you have to go in the hospital? That's where we focus. There are more people in the hospital with COVID and have other reasons for being in the hospital, but for these briefings in particular, we've focused on the severity of the illness to the point that it causes somebody to require hospitalization. That's the thinking behind it. I still think that it's fair and reasonable thinking.
Yeah, the Premier explained it well. From a public health perspective, we're focusing on indicators of severe disease. All our efforts are around minimizing the numbers of people with severe disease and focusing resources to protect people most vulnerable for severe disease. The health authority also looks at with their utilization pressures, they look at the other aspects as well. But from our overall perspective, that the focus on severity is where we continue to pay the closest attention.
Go ahead with your follow-up, Jean.
Dr. Strang, in light of what we've heard in recent days about the number of health workers, the number of long-term care workers who are off either because they've contracted the illness or they are close contacts, can you talk a little bit about the discussions that are going on to try and change the protocol so that people who are either close contacts or are better from the disease are able to get back to work and give some respite to their colleagues who are left behind?
So we made some substantive changes recently when we made the decision, and it wasn't the primary purpose wasn't to get people back to the workplace, but it's an important outcome that people who are, if they're fully vaccinated or under age 12, and that's not relevant for the workplace, but if they're fully vaccinated and they're identified as a close contact, they have to isolate and do the testing, but they can continue to go to work or school as they follow careful masking protocols. That already has had a substantive impact, not just in healthcare, but in a whole range of business sectors, about allowing many more people to come back to work and not having to do have a complete isolation while they're contacts and doing their testing protocol. I know that certainly in the healthcare that my colleagues in infection prevention control and occupational health and safety continue, and they're the ones who are responsible for in facilities, continue to look at ways that they can safely, and I have to emphasize safely, you have to have the right protocols in place to bring people back from being contacts into the workforce early. Worst case scenario, there are ways to bring people who may be finishing their infectious period while they're from being infected, even bringing them back under very strict protocols. So they continue to look at those and using those where necessary. I think it's important to say we would only bring people who are COVID cases back under very strict protocols and only if absolutely necessary when there's critical care needs.
And next we'll go to Global's Alicia Drouse. Go ahead, Alicia.
Thank you. With the Omicron variant being a lot more contagious than previous variants, I'm just wondering what the best mask for the general public to wear is, and if it's at 95s, are those only effective if they've actually been properly fitted?
So, N95s are a specific type of mask for a specific use in certain types of occupations. I think because of one of the key things is the importance of being fitted appropriately. For the general guidance, the guidance for the general public is now that as a minimum, people should have a 3-layered cloth mask or a medical mask. And the 3 layers is important. No longer the 1 or 2 layered masks. We know that those 3 layers are especially with Omicron, are necessary. But I keep, every time I'm asked, I have to make the point that while the type of mask is important, wearing the mask where it's necessary and wearing it properly, snugly fitting over the nose, cheeks, and around the chin. And continuing to wear that at all times where it's required are as important as the type of mask you're using.
Go ahead with your follow-up, Alicia.
Thank you. This one's for the Premier. With Quebec looking to tax potentially non-vaccinated people for health care, is this something that Nova Scotia might consider?
It's not something that we're considering, and I think I think what you're seeing from like the federal minister with the vaccine mandates and Quebec's position, I think you're just seeing like the people who are trying to manage the system are incredibly frustrated that this is an illness that people have an option to get the vaccine and really limit the severity of the impact on them, and by not doing that, there's ramifications to society and to our healthcare system. So we're not talking about either of those two things here, but we want people to get vaccinated. The vaccines are safe. The vaccines are effective, and the vaccines are the best way to keep yourself safe, your community safe, and quite frankly, your province safe, and take pressure off the healthcare system. So I understand the frustration that people are feeling, and I share it. But those aren't specific discussions we're having here in this province right now. But we do encourage people to get vaccinated.
Moving along, we'll go to John McPhee at the Herald. Go ahead, John.
Thank you. Premier, if we're in the most serious situation we've ever faced in the pandemic, as Dr. Strang just said, the question remains why we're reopening schools next week. Why are you comfortable doing that, given what we've heard today about the severity of the situation that we're facing right now?
Look, we follow the advice of public health, we follow the advice of the experts, and we marry that up with the fact that we know that schools are the best place for our children. We've talked at length about, for many children in this province, school is where they're safest. It's a sad reflection of our society, but it's an honest one. For many children in this province, as we head into winter with extremely cold temperatures, the school is a place where many children are warmest. Many children get their food at school. So we understand all of those social impacts, and then it's the impact on their own mental health, their physical development. Schools are the best place for kids. So our schools are safe. We'll move forward. I think we've shown that where necessary to close a school, we will. We did that through the fall. We did that last year. If there's operational issues or issues with outbreaks, we will take steps to close schools, and we expect that will have to happen. But we have almost 400 schools in this province, and we want kids back in schools because they're safe in schools. There's other issues we're taking. We're encouraging people to work from home. We're encouraging people to follow all the public health guidelines. All of those steps are designed for each of us to do our part to keep our communities safer, because when we keep our communities safer, we keep our schools safer. So if we can do anything that we can do on an individual level to decrease our personal contacts, Dr. Strang and I are doing it today. We're doing it because we want to limit our contacts so that we keep our communities safer, so therefore we make our schools safer. But school is the best place for kids. That's the advice of the experts. That's the advice of public health, and our kids will be back in school on Monday.
John, do you have a follow-up?
I do, thank you. This is also for the Premier and still sticking with schools. Questions have been raised about the effectiveness of the portable air filtration units that have been purchased for schools. Experts have said that the clean air delivery rate is called of those units won't be enough to purify a particular classroom. Just wondering if the government is aware of those concerns and what kind of monitoring will be done to ensure that they're doing the job.
Yeah. So first off, let's remember that these systems are kind of above and beyond. We're doing something there because we know there was a concern, and we want public confidence to be as high as possible. So from a public health perspective, these machines weren't a necessity for people going back to school. But we've layered that on as we continue to layer on protections. We've layered that on. I know that there's a great number of experts saying these are perfect for this situation. There may be others that say otherwise. That's the nature of experts, I guess. But for me personally, we know that these machines will give people a lot of confidence, and we know that they'll do their job to increase the safety of people. And I am happy that we were able to work with suppliers, and the team was able to make this happen so quickly. So it's a good thing, and we'll continue to do everything we can to keep those working in the schools, teachers, custodians, staff in the schools safe, and the students safe as well.
Next, we'll go to Keith Doucette at the Canadian Press. Go ahead, Keith.
Hi, Dr. Strang. I recall you previously expressing some time ago that you had some hope that we may have seen a plateau or approaching a plateau in terms of the numbers of infections. But obviously something has changed since then. I'm wondering what it is. Is it the holiday season? Are we finally starting to see the numbers, or the spread kick in because of the holiday season, or is something else going on here?
Oh, we've had widespread for a couple of weeks. Probably more than 3 weeks. We did see a peak a week ago related to Christmas. We saw a very short kind of peak this last weekend, a week after New Year's. So, we expected those, but we're back down again to, but still at very, much higher daily case counts than is sustainable over the long term. So we still have to a lot of work to do to slow the spread down and get us through this Omicron wave. It will start to come down at some point. Those people who are vulnerable to being infected will have been infected. That's the way epidemics work, and we will start to see this coming down in the next few weeks. But right now, I think we're at right in the middle of the peak of the wave, and there's still a lot of hard work to do ahead. And as we've talked about, it's creating substantive impacts both from a workforce perspective and also the capacity of patients within our hospitals right now. So we have some challenging days ahead.
Go ahead with your follow-up, Keith.
Yes, this is for a colleague in Quebec. As you know, your colleague in Quebec, Dr. Arruda, suddenly resigned on Monday. He went from being a very popular figure to one of some derision in some quarters in that province. So I'm wondering whether you think the daily grind over time of having one central messenger such as yourself wears on the public, given that you yourself have also been the target of some criticism and even protest.
So I'm not going to speculate around. I think there are a number of factors behind the scenes around Dr. Arruda's decision to retire. Whether the public is becoming tired of hearing from me or not, I don't know. I get lots of, while there are people that are critical, I also get lots of people reaching out and saying, giving me support and say how valuable it is that to hear my voice at briefings. So I'm going to continue to be the Chief Medical Officer of Health and work with my very expert and hardworking colleagues, work with the Premier, and my commitment is to be here and to help get Nova Scotia through this pandemic as safely as possible.
Moving along, we'll go to Adrienne Blanc with Radio-Canada. Go ahead, Adrienne.
Thank you. Dr. Strang, we heard today that Canada has enough doses for a fourth dose. Is that something that public health is already planning for?
No, the only people that were planning for a fourth dose are those who NACI is recommending a fourth dose, and that would be people who are moderately to severely immune compromised, who are have been for the last couple of months been eligible for a third dose in their primary series, and then in May and June be able to get their booster dose. There is no evidence whatsoever that at this point in time that a fourth dose is going to be necessary, other than the circumstances I've just described. If that changes and if NACI makes recommendations, we would look at doing that. But I'd say we always follow an evidence-based approach, and I think as a country we also need to be very concerned about the ability of other countries to offer even first dose, and ultimately we will only be safe here in Nova Scotia and in Canada when there's much higher vaccination rates around the world. So we should also be paying very close attention to this from a global perspective.
Adrian, do you have a follow-up?
Yes, for Premier Houston, you said you were against mandatory vaccination, but many jurisdictions are in favor, with the rationale that unvaccinated people are representing a burden, a direct burden on the healthcare system. Is it something that you see in Nova Scotia, that there's a link that can be done between how many unvaccinated people there are and the burden they represent on the healthcare system?
It's true. If you look at our hospitalizations, 25% of them are people that are not vaccinated. In a province where we have over 90%, vaccination rate, it's a disproportionate impact on our healthcare system. That is a fact, and that is certainly frustrating for sure. We've taken a number of steps. We've required vaccines to work in certain professions. Some people have lost their job because they're not vaccinated. We've required vaccines to do certain things. So we'll continue to encourage people to get vaccinated. There will continue to be a choice people make, but the choice to be not vaccinated has ramifications, and those ramifications already exist in this province. We're not talking about mandatory vaccines across the board, but I certainly share the frustration that many of us feel with the impact that those that are not vaccinated are having on our healthcare system and our communities.
Moving along, we'll go to All Nova Scotia. Paul Bacon. Go ahead, Paul.
Thank you. Premier, Dr. Strang talked about the 500 to 700 healthcare workers who are unable to work on any given day because they're self-isolating, either because they've been exposed or potentially exposed. When classes resume next week, it seems likely that a lot of teachers are going to find themselves in the same boat, and a lot of schools are going to have trouble finding enough staff. Does the province have a strategy or have steps they will take to mitigate that, calling up more substitutes or other things?
Yeah, there's obviously lots of planning going on, and certainly in healthcare, you'll hear more from the health authority about some of the movement of people and the changes that are happening there to support those that are in staff. And my understanding is that on any given day, there are 9,000 or 10,000 people working in our healthcare system, day in and day out. And right now, a lot of, we're seeing a few hundred people every day that are off sick. So it's having an impact. It's a percentage of the people that are off sick in healthcare. We're seeing that in every business and every organization around the province. We expect that we will see that in education for sure. But, we're looking at different steps of, as you mentioned, substitutes, freeing up people who are qualified to teach but are working in the system in another capacity, not in a classroom, mobilizing them to be in a classroom. So these are things that there's a lot of thought and a lot of energy going into making sure that we can meet the challenges that we know await us. But we want kids back in school. It's the best place for them.
Go ahead with your follow-up, Paul.
And Dr. Strang, you mentioned 3.6 million more rapid tests you're hoping to arrive in the next few weeks. But that doesn't mean the province is going back to its widespread testing strategy. Is that correct, that that is basically over for the foreseeable future?
That's correct. I mean, unless we get a much more robust supply, but if we're going through our current testing streams, or or 800,000 a week. So you can see that 3.6 million doesn't actually go for that far. So we will be maintaining our prioritized approach to testing for the foreseeable future, and quite likely as we this will take us through the Omicron wave, and then we have to rethink our whole testing strategy entirely as we move much more into an endemic phase.
Next, we'll go to the Halifax Examiner, Tim Bousquet. Go ahead, Tim.
Hi, thank you. Dr. Strang, I appreciate that better data, more data is being provided around hospitalization, but I'm going to ask you for more still. The Premier said the average stay in hospital is 5.8 days. Can we get a sense, are the people who are just coming in for a day or two, are they younger, better vaccinated? And what's the situation for those specifically in ICU and deaths? Are they vaccinated or unvaccinated people?
So you're getting into areas, Tim, around the circumstances around individual people. So we always have to be, especially around deaths and the small numbers in ICU, we have to protect their personal health information. In general, I mean, I don't dive into the details on length of stay and all those kind of breakdowns. So, I mean, the health authority looks at that and uses that for a lot of that. It feeds into our, ongoing planning for the use of their resources and what capacity they may need to build. But that is really more for planning purposes.
Tim, do you have a follow-up?
I do, for the Premier. Premier, in 2020, when the pandemic started that summer, there was something called a pandemic premium for healthcare workers. It was paid an extra $2 an hour for up to 4 months' work. And this was early days in the pandemic. There was a difficulty, especially around long-term care workers at that time. But arguably, the pressures on healthcare workers right now are much greater than even then. Is there the ability, or will you provide extra emergency funding for healthcare workers?
You're absolutely right. The pressure on our healthcare workers and across the entire system is as high or higher than it's ever been. So you're absolutely right on that point. These are types of discussions that we're constantly having. How can we the first instance is how do we support people by moving people around, rejuggling things to make sure that they have the support they need to do their job effectively. And people that are in the hospital, people that are seeking out care in this province are getting incredible care from people who are under incredible pressure. But you raise a point on the compensation aspect. These are discussions that will continue to happen, and we'll have those discussions internally. But we definitely want to support our healthcare workers as best as we possibly can.
Moving on, we'll go to the Cape Breton Post and Nicole Sullivan. Go ahead, Nicole.
Thank you very much. This is for you, Dr. Strang. I've spoken to a number of parents who are struggling to get their children vaccinated, and that's because of their medical history. They've been trying since their children were able to get the vaccinations at the ages that they're at. Some are flat out being refused to be given vaccinations at both pharmacy clinics as well as the IWK vaccination clinic, told that they need medical clearance before they can get it, but no direction as to where to get the medical clearance, how to get the medical clearance, or even how to get medical exemption for the proof of vaccination policy until they can, if ever, safely get the COVID-19 vaccine. I'm wondering what you would tell people in these situations, what they should do, and what procedures should be taken by healthcare professionals who have deemed somebody's medical history to make them at risk of adverse events from the vaccine, what procedures they're supposed to take once they refuse to provide that vaccine.
I'm only aware of a single story like that. I mean, there are very few reasons, very few at all, why a child could not receive their vaccine. And the IWK has many specialists and experts, and they are running a clinic directly. Certainly, for the rare circumstances where the child may need an exemption and can get the vaccine because of previous history in terms of reaction to vaccines. We actually have a process in place, and this has been repeatedly communicated to primary care providers, that they can have an urgent referral to specialists, including allergists, for an assessment. And when I know in the experience with adults, the most of the time when we've had people who thought that they couldn't get the vaccine because of allergy history, when it's reviewed by experts, they're recommended that it is safe for them to continue to get a vaccine. So I can't speak to any specific circumstances, but we'll do everything we can to ensure a child can safely get vaccinated. And there's lots of experts in this province. We're very fortunate to have pediatric vaccine experts to support individual clinical cases.
Do you have a follow-up, Nicole?
I do. Thank you very much. And again, these are families that really want to be vaccinated. The children involved also want to be vaccinated. And I had sent some questions to the Department of Health and Wellness, and in a written response, they indicated, and it was excellent information that was provided, and it's much appreciated. But one of the things that was pointed out was that there are these pathways through Nova Scotia Health and the IWK Health Services for people who need additional supports to get vaccinated. There is one family I spoke to. They believe their child has a phobia of needles, things piercing through the skin, and they've been trying desperately to access any of these pathways to help their child get vaccinated because the restrictions that are in place are basically her mental illness. Now, for this family, others in Cape Breton and Nova Scotia that might be dealing with this type of situation, can you tell us what supports are in place? Is there something like a nasal COVID-19 vaccination that has been approved in Nova Scotia in situations like this?
We put in each health zone, there are contacts through public health working with clinical colleagues to provide all sorts of supports, from even going to the extent of going to somebody's home to vaccinate them in a safer environment, or even bringing people into an inpatient hospital environment with the right supports. So there are pathways in every zone to provide the necessary supports to deal with all, a whole range of whether it's fear, anxiety, people, children with complex, or even adults with complex disabilities that require lots of additional supports. We have been doing this successfully for months, so I'm not sure why people would have difficulty accessing those supports at this time.
We have time for one final outlet. We'll go to Guysborough Journal. Lois Ann Dort. Sorry, Lois. Go ahead, please.
That's all right. Thank you. Appreciate the time. Premier Houston, you said that rapid tests in schools would be for those who came to school symptomatic or developed symptoms while at school. If you have symptoms, shouldn't you stay at home, and might people come to school just to gain access to the test?
Thank you, Lois. If you have symptoms, yes, stay home, no question. Do not try to game the system and go to school to get a test. That would be a ridiculous thing for somebody to do. I hope we wouldn't have anyone trying to do that. If they have symptoms, they should stay home, no question about it.
Do you have a follow-up, Lois?
Yes, thank you. The government often talks about the mental health impact of not being in school for students. Has anyone assessed the mental health impact of being in school during a pandemic? Thank you.
Certainly, there's ongoing supports in school in general for children and youth with mental health issues, and for some kids, being in school can be a place that that creates a lot of anxiety and other challenges. But in general, when you look at the impact around broadly in all children and youth, that there's much greater impacts collectively of being held out of school. And this has been a challenging time, and there's a lot of concerns around mental health in general in children and youth, particularly from the last 2 years. And so we're going to have to pay attention to that. But quite frankly, the ability to support children and youth through schools is an important part of that, addressing those overall mental health issues. It's easier to do that in a school environment and build supports into the school than trying to identify and build supports one-on-one for kids who are in a community-based environment.
And that's all the time we have for questions today. Premier?
Thank you, Dr. Strang. Thank you to everyone watching and for your questions as well. I understand the frustrations. I'm hearing them from Nova Scotians. I understand them. I share them. I'm also frustrated. This variant is presenting our biggest challenge with COVID to date. And it's beginning to feel like, and if you ask a lot of the experts, it certainly people would say that at some point it's going to touch most of us. And I know some people are scared. I know people are divided. But this has been a long journey. And on this long journey, Nova Scotians have faced so many fears and so many unknowns and continued to move forward. Tentatively at times, yes, but always trusting public health and using science and the best, most up-to-date health research. That's what's led us this far, and it's what will continue to lead the way. So our trust has been well placed in public health, and I thank Nova Scotians for that, and I know the team at Public Health does as well. So I have every confidence in our plan, the plans that are presented. They're built on the best information that's available. That's not to say they're perfect. We'll change as necessary. We've shown that we'll do that as well, but we only have one objective, and that's to keep every Nova Scotian safe and to keep every Nova Scotian healthy. So thank you for doing your part. Thanks, everyone.
So there we are. That is the COVID-19 media briefing for today, Wednesday, January the 12th, 2022. Thank you for joining us here on Telile Community Television's YouTube channel. My name is Adam Cooke. I'm the news host and producer for Telile. And there were a couple of takeaways from this afternoon's media briefing. Premier Tim Houston and Dr. Robert Strang, the Chief Medical Officer of Health, both confirming that students are returning to the classroom on Monday as originally planned. They are going to complete their week of online learning this coming Friday and head back into the classroom on Monday. And when they get there, they're going to have rapid testing kits to use. The Premier confirming today 25,000 rapid test kits going to 400 schools around the province. This will be distributed by enrollment, as these things often are. The Premier and Dr. Robert Strang also confirming that Nova Scotia is currently handing out 830,000 rapid test kits a week. They say that is enough for every Nova Scotian to get tested. However, they are hoping to get more test kits from the federal government in the days and weeks to come. No word on new testing clinics for Richmond County or Port Hawkesbury. We're hoping to hear some more about that over the next day or so, especially considering that 3 testing clinics for Inverness County, Inverness, Port Hood, and Cheticamp, were confirmed less than 24 hours ago. What we can tell you is that Nova Scotia seems to be moving away from reporting the COVID-19 daily case numbers and overall case count. Dr. Robert Strang at a previous media briefing had mentioned that people should expect that because of the difficulty in getting accurate figures due to the large spread of the Omicron variant of COVID-19, and as well the difficulty in keeping up with testing, that it would be harder and harder for the province to provide accurate figures, so they would be moving more towards a hospitalization numbers model, so that the numbers you're getting day by day are centering on hospitalizations, also on outbreaks and deaths from COVID-19. Sadly, we've had 5 of those over the past week. In terms of hospitalizations, currently 66 Nova Scotians now in hospital due to COVID-19, 4 of those in the intensive care unit, and we can confirm as well, as of yesterday, 616 new cases announced for Nova Scotia, and there were about 6,700 active cases of COVID-19 reported in the province on Tuesday, January the 11th. That's the last full report we've gotten in terms of the numbers. Some news coming out of Quebec that could have an impact on how COVID-19 is handled here in Nova Scotia. First of all, Premier François Legault announcing yesterday that a tax would be put on Quebecers who do not get vaccinated for COVID-19. That represents about 10% of Quebec residents. Premier Legault stating that he wouldn't be going with something as low as $50 to $100 in terms of a charge, that he expects it to be higher than this, although the number hasn't been set down yet. That same question asked earlier today in the media briefing of Nova Scotia Premier Tim Houston. He kind of sidestepped around the issue a little bit before arriving that the most important thing to do was to simply get vaccinated. So it doesn't look like the province of Nova Scotia is going to take up a vaccination tax anytime soon. We're also hearing from Dr. Robert Strang about the resignation of Quebec's Chief Medical Officer of Health on Monday evening, and wondering whether criticism over such things as curfews and lockdowns in that province led to that resignation, and whether it could have an impact on Nova Scotia. Dr. Strang stating that Nova Scotia is a separate jurisdiction, just like any other province or territory across Canada, so it would be difficult to try to extrapolate what happened to Quebec's Director of Public Health, as opposed to what could happen to Dr. Strang or any of his counterparts across the country. But those are the big takeaways from this afternoon's COVID-19 media briefing. As always, we welcome any of your questions in terms of COVID-19, vaccinations, or any aspect of the pandemic. Feel free to send them directly to me. You can contact me directly. My phone number is 902-625-8863. You can also reach me by email. The address is adamjrcook, Cook with an E, @gmail.com. Feel free to send your vaccine and pandemic questions to Telile Community Television as well. The station phone number in Irishat is 902-226-1928, and the best email address to use, info@telile.tv. And speaking of Telile and the station in Irishat, don't forget that visits to the station are by appointment only. The office is effectively closed to everybody except those who are working at Telile Community Television. This will not affect Telile's Community Television's weekly bingo broadcast, but you do have to be careful in terms of thinking that you can get into the station. That won't be happening until at least the end of January, and we'll see how things go in terms of restrictions by then. That's all we have for you today in terms of COVID-19 here in Nova Scotia. My name is Adam Cooke. Thank you again for tuning in to this special presentation on Telile Community Television's YouTube channel. We will continue these presentations on an ongoing basis as 2022 continues. Until next time, take good care, everybody. Stay safe, and we look forward to speaking to you again very soon.